Yeah.
So we were arguing about something and he took out a gun.
Threats of suicide, then a gun. It wasn't the first time Alyssa Pence says she was put in this situation.
Just kind of like not fazed by it, and then he actually did. So, it's important to take people seriously, when they say those things.
But on that day in 2014, 19-year-old David McClung's words turned into actions. Alyssa standing just inches from her first love.
Felt like an eternity, when it's happening.
She says she was worried to call for his mom, who was downstairs.
Thinking that if I didn't call her, maybe he wouldn't do it.
Literally just seeing his lifeless body on the floor literally brought me to my knees. And I feel like I've been trying to stand up ever since.
They called 911.
It was too late, but they just kind of kicked us out of the house, and then we were all questioned, and that was it. I didn't get to see his body again until the funeral. Definitely a big shock.
David had dreams of being a rock star and a funeral director. His mom says he was emotional, but a good kid. Her grief, now unbearable.
Between guilt and anger and confusion and, just the simple fact of your world's devastated, but you see the rest of the world going on as usual.
And unfortunately, that level of grief is felt by many families in Virginia. Take a look at these numbers. 87 kids statewide committed suicide in 2020. In Hampton Roads, 17 kids took their own lives. But what is also concerning is the number of kids reaching out to the National Suicide Prevention Lifeline in Virginia, which they say could be due to more awareness. So far in 2021, 81 kids under the age of 12 have either called or sent a text message. That's a 143% increase compared to the same period in 2020, according to Lifeline leaders.
We usually got, a handful a month at the most of, 12 and under, but now we're seeing quite a bit more. And while the numbers themselves aren't like drastically big, or, it's not massive numbers, any increase in children under the age of 12 connecting with a crisis intervention service is concerning.
For kids ages 13 to 17, almost 1,600 kids reaching out in 2021, and that's a 300% increase over the same period in 2020. 26% of all kids saying they're experiencing family violence, and 39% say they're experiencing active thoughts about wanting to end their lives.
So young people are feeling stress at home, feeling stress with the pandemic, feeling stress with social distancing, and that's leading them to feel trapped, and that leads to suicide thoughts. So we're kind of seeing what everyone else is seeing, which is higher stress.
The nonprofit Psychiatric Rehabilitation Services works with the government to provide mental health resources. Program Director Laura Meyer says what's troubling more than the numbers is what the kids are saying when they call or text, especially since they've been back in school this year.
The difference now is it's not just I don't want to be here tomorrow, it's a wish to be dead, and it's a wish to act on that. And so we have individuals, very young individuals, who have thought about, plans for how they would complete their death, and that's really where we start to get very concerned.
And the concern over the youth and the increase in numbers is what drives this mother to now volunteer and work as an advocate for suicide prevention.
I think helping others is a big part of my healing.
Mental illness is not who a person is. It's like any other sickness, and they just need to be treated,
Wow, to all of that. And News 3 investigator Margaret Cavanaugh joins us right now.
So you hear the grief from that mom and the guilt. What do parents need to look out for?
Yeah, well, the experts, that is something we talked about. You want to look out to see if your child's making suicidal statements, being preoccupied with death in conversations or drawings, or withdrawing from friends or family.
Well, those are some of the things to look out for. But as a parent, I'm sitting here thinking, I'm armed with that information. What do I do? What do I need to do?
Well, they say immediately you want to contact the child's doctor, and you want to talk to the doctor about getting the child more therapy. They also say, don't be afraid to use the word suicide and approach the child and listen to what they're saying, because a lot of times, parents get really upset. They say to also try to stay calm because the kid's already feeling very overwhelmed.
Open your ears.
Yes, that's right. And we have this number if you want to call, 800-273-8255. You can call that number if you are suffering from this or if you are concerned about somebody else. And they say it's also important for parents to get the help themselves that they need if they are dealing with this, because it can obviously be a lot. And this is all part of a series that we're working on, focusing on mental health. Thursday, we're going to be looking at what's going on in the schools.
We decided that attacking mental health was really a way to attack poor attendance or discipline problems or poor academics.
Thursday at 6 a.m. we'll talk to the schools about what they're doing and what programs they have in place to kind of reduce this problem. We hope that you join us.
Okay, it's a lot to learn, and we should be aware. Thank you, Margaret.
Very powerful. Thank you, Margaret.